Hello, and thank you for joining me at the Laurels Awards, part of the 2021 Prevent Cancer Dialogue. These awards are presented annually from the Prevent Cancer Foundation in partnership with the National Colorectal Cancer Roundtable. My name is Andrea Rohn, and I'm a longtime board member and supporter of the Prevent Cancer Foundation, and it's my honor to present the 2021 Laurels Awards. The laurel has long been a symbol of tribute, honor, victory, merit, and reward. That's why the Prevent Cancer Foundation chose the laurel to represent our winners and the remarkable contributions they've made to cancer prevention and early detection. As you'll soon hear, our award winners are not only esteemed experts in their fields, but dedicated individuals who inspire all of us with their passion and perseverance. Now it's my pleasure to present the first award for the Laurel for Increasing Health Equity through Innovation to Dr. Tsu-Yin Wu. In her role as director of the Healthy Asian Americans Project and Center for Health Disparities Innovation and Studies at Eastern Michigan University, Dr. Tsu-Yin Wu is a researcher, professor, and community advocate. She has worked tirelessly to provide evidence and data to support the urgent need for public health funding for underserved Asian communities. The statistics and findings in her research have revealed pervasive health disparities for Asians and Asian Americans. Dr. Wu has led her team in building a culture of health and implementing best practices for culturally sensitive programs that promote breast, cervical, and colorectal cancer screenings among Asian Americans. Globally, Dr. Wu has implemented strategies such as training breast health ambassadors that have resulted in thousands of women receiving breast cancer screening and follow-up diagnostics and treatment. She has been an extraordinary role model in her vision and leadership in addressing health disparities in cancer screening and prevention. On behalf of the Prevent Cancer Foundation and the National Colorectal Cancer Roundtable, I am proud to recognize Dr. Tsu-Yin Wu today with the 2021 Cancer Prevention Laurel for Increasing Health Equity through Innovation. Her demonstrated leadership and dedication in cancer prevention has made a world of difference. Thank you, Dr. Wu, for your persistence, collaboration, and innovation. Next up is our laurel for dedication to community service, presented to Ms. Nwabukwu, a woman who I know well from serving with her on the Georgetown Lombardi Community Advisory Council. Ms. Nwabukwu is the president and founder of African Women's Cancer Awareness Association based in Washington, D.C. For the past 16 years, she has been dedicated to identifying and meeting the community needs for cancer prevention and screening, working to reduce disparities in awareness, education, prevention, and access to treatment and care for African immigrant women. During the COVID-19 pandemic, Ms. Nwabukwu re-strategized and raised $150,000 to continue serving the breast cancer community. She has distributed personal protective equipment to Black breast cancer survivors and families, coordinated virtual public health outreaches, and ensured Black women in the community are receiving the patient navigation services and mental health support they need. She knows firsthand what these women need because she is a breast cancer survivor who lost her mother and best friend to breast cancer. She has dedicated her life to encouraging early detection and screening for breast cancer. On behalf of the Prevent Cancer Foundation, I am proud to recognize Nwabukwu today with the 2021 Cancer Prevention Laurel for dedication to community service. Her commitment to education and screening services for medically underserved communities is saving lives. Thank you, Ms. Nwabukwu, for your unwavering commitment, passion, and service. Now it's my distinct honor to present the Laurel for National Leadership posthumously to Dr. David Ahlquist. Dr. Ahlquist was a gastroenterologist who knew the biggest impact he could make on colorectal cancer was through improved early detection. He led a scientific team in optimizing molecular probes to separate fragments of human DNA from massive amounts of bacterial DNA. The result was an FDA-approved multi-target stool test to screen for colorectal cancer. Dr. Ahlquist's long career included many breakthrough ways of thinking. He had more than 25 years of continuous funding from the National Institutes of Health, more than 200 peer-reviewed manuscripts and book chapters, and more than 80 issued patents. He was guided by his North Star of reducing the cancer burden and was fueled by creativity, humility, and mission-drive entrepreneurialism. Dr. Ahlquist died on November 1st, 2020, due to complications from ALS. On behalf of the Prevent Cancer Foundation, I am proud to honor Dr. Ahlquist posthumously with the 2021 Cancer Prevention Laurel in National Leadership. His wife, Susan Ahlquist, and colleague, Dr. Paul Limburg, are accepting the award on his behalf.
Thank you, Andrea, for that wonderful introduction, and thank you to the Prevent Cancer Foundation for recognizing Dr. David Ahlquist, my colleague, mentor, and friend, with this truly special award. I was fortunate enough to have known Dave for over 2 decades, and in addition to being a compassionate clinician, first and foremost, he was a visionary leader and a pioneering innovator in the field of cancer early detection. Dave was always eager to take on new challenges, particularly those with high potential to transform or disrupt the status quo. With the goal of reducing cancer incidence, mortality, and suffering as his steadfast North Star, Dave navigated uncharted territories to find exceptional opportunities in unexpected spaces. Perhaps most notably, his tireless efforts to discover, develop, and deliver a better test for colorectal cancer screening resulted in the FDA-approved multi-target stool DNA assay known as Cologuard, as Andrea mentioned, which has been used by over 5 million people to date. More recently, Dave embarked on another quest to fundamentally change cancer early detection by moving from a single organ to a multi-organ approach. These exciting activities and efforts are ongoing, catalyzed by the seminal research generated from the Ahlquist lab. Throughout his career, Dave sought out creative collaborations and productive partnerships to accelerate progress, whether with colleagues from halfway down the hall or halfway around the world. Without fail, Dave recognized and respected these diverse perspectives gained through these relationships and celebrated their collective accomplishments as team-driven success. I'll close my comments by expressing both my professional and personal gratitude for all of Dave's outstanding contributions, which have had such a tremendously positive impact on his patients, his peers, and public health overall. With that, I'll turn it to Susan Ahlquist for her reflections.
Thank you, Paul. Your generous tribute, true friendship, and understanding of Dave mean more than you can know. On behalf of our family, I offer heartfelt thanks to Beau Aldeget and the Prevent Cancer Foundation for this recognition of Dave's life's work and legacy. Dave would particularly want to acknowledge you, Beau, for your visionary leadership, tireless efforts, and significant accomplishments. And to have the award presented by you, Andrea, is a special honor. You live what this award represents. I know that Dave would be humbled to be among this impressive group of past and present Laurel Award recipients working to change the world. Congratulations to Drs. Wu and Nwabukwu. Many of you knew Dave as a colleague and a friend. He was an adventurer, a risk taker, and a committed iconoclast. His sense of curiosity and wonder made his life journey remarkable and full of surprises. He was a storyteller whose vision and passion drew others in to possibilities. Our family called Dave round the next bend Ahlquist. In his life and in his work, he never stopped exploring. He was endlessly intrigued by what might lie just around the next bend. Stepping toward the unknown, his favorite place to be. It was in nature, holding a fly rod or flying down a ski trail, that many of the ideas he's being recognized for today took shape. Dave lived with vision-guided purpose every day and made every interaction count. His drive for excellence and transformation were matched only by his commitment to the integrity of the science and the needs of patients. He never used the word I when referring to his work, always acknowledging the we that it takes to accomplish meaningful change. As Paul said, successes are the team's success. Challenges are faced together, always moving forward. There was no there for Dave ever. And he knew that realizing a vision requires an integrated continuum of committed people and organizations. Dave had the privilege of spending his career at Mayo Clinic. He was part of dedicated and passionate research teams both at Mayo Clinic and with Kevin Conroy and the team at Exact Sciences. Through that partnership and shared vision and the exciting ongoing work with many around the country and the world, lives are being saved and forever changed. While he would have loved to be here to see his vision become reality, Dave closed his eyes grateful for the opportunities he had to make a difference. He felt hopeful, knowing that talented, visionary, and committed people would face the daunting challenges, see opportunities, and find successes in ways he couldn't know but imagined every day. We carry him with us into that very bright future. Thank you for honoring Dave in this meaningful way. Congratulations to the other Laurel Award winners, and best wishes to all of you on the journey ahead. Thank you.
Susan and Paul, thank you, and know that we will always remember Dr. Ahlquist for his progressive thinking, scientific curiosity, and exemplary leadership.
Thank you.
And thank you all for joining us for the Laurel Awards at the third Prevent Cancer Dialogue webcast. We hope to see all of you next year at the 2022 Prevent Cancer Dialogue for more great conversation on trends, innovations, and updates in cancer prevention and screening. Goodbye.